I'm a nurse practitioner in pain management, as you know, and one of the concerns that we have is the safety of pain management regimens. We know that there's safety, there's risks and benefits to all of the options that we have, not only medication management, but every other option as well. And I'd like for you, as a person with pain, to tell me a little bit about how you've maintained safety throughout your time with pain.
Well, it's been a long journey for me. My pain started, unfortunately, when I was in my very early 20s while I was a college student. So my pain management regimen has changed dramatically over the years. My current regimen includes an opioid, a long-acting opioid and short-acting opioid for rescue medicine. And I have had to become very cognizant of the safety issues that go along with having those medicines in the house. For example, while my children were growing up and as they reached their teen years, of course, I realized that even the best-intentioned teenager or their friends coming into a party, if they know that mom has a pain issue, I knew that it was paramount for me to keep my medication safe. So what did I do? I went out to the office supply store and I bought myself a little safe and with a key, and I kept my opioid medications in that lockbox, hid the key, only told my husband where the key was. And that made me feel so much more confident that my medication would not wind up in the wrong hands. The one element also that I did is I had a very frank discussion with my children as they reached their teen years about diversion, about what could happen to them if they were to accidentally take any of my medication, that they could risk heart attack, they could risk coma, and it was not something that they would ever want to experiment with.
You have learned this over your time with your course of pain. When you first were given a health care prescription or a plan of care for your pain, how did your practitioner first go over these things with you? How did you come to know what you know today? What things did you go over?
Boy, I'll tell you, I could write a book. In the very beginning, I have to say things have come a long way. Let's put it that way.
Yeah.
In the beginning, I was given a prescription and an appointment for 3 weeks later and said, you know, see you later, goodbye. And that was it. No explanation. I would go to my pharmacist and say, what is this stuff? How do I take it? What are the ramifications? What are the side effects? So unfortunately, the burden was upon me as the person in pain to find out how to take this medication.
And you know, I think you're right, as we've really come a very long way. In practice today, what is the safest way to sit with one of our people with pain is to go over, do a risk assessment. As a healthcare professional, I know I need to assess my patient's pain, but also their risks for the use of opioids or the risk for any one of the other options. And to do that clear risk assessment, and then to also go over with, and I would say patient for me because I'm in a hospital or in a hospital situation, is to be very clear that that person is well aware of just the pieces that you've already talked about, the safety of having a lockbox, the safety of not mixing alcohol if there's an opioid that's in use, and to make sure that that drug isn't used more frequently than what it's prescribed for, unless there's a conversation with me as a practitioner that there may be an increase in short-acting and not in long-acting, but that's a trusting relationship that we have together, and that those decisions are made together in concert. Then the piece is, as I know, it must have taken you a long time to get to what you know about pain management today. And part of what we're doing today, and newly for me even as a practitioner, is to do something that's called teach back, so that I would, for instance, with someone who doesn't have your knowledge, go through what I just said and then say, I may not have been very clear with you. Could you just tell me back what I've just said so I can make sure that I've been clear with you what we need to go to do together?
That's fabulous. That's just so fabulous, because so many people, I think, walk out of a practitioner's office without a clue of how they're supposed to take their medications. Oftentimes they don't understand the difference between a long-acting analgesic, whether it be opioid or not. They don't understand how long it's supposed to last. They may think that they could take more than one, if you know, and it may not be prescribed that way. They may not understand what a short-acting analgesic is and what it's designed for, and when they should take that, what breakthrough pain is. There's so many things that people need to know. And not only that, but their family members need to know too. There is so much confusion on the part of both people who have illness, their family members who care so much for them, but who also have these preconceived notions that often are not true. And I myself have experienced over the years of being on an opioid, of having periods where it just is not working as well as it used to be. And because I have a very good relationship with my healthcare provider who can explain to me and work with me to say, you know, she says, well, you know what, you've been on this dose, you know, for 2 years. Your body has developed a dependence, you know, has a tolerance, I'm sorry, to this medication, and perhaps we need to bump it up a little bit. And wouldn't you know, she's right. And all of a sudden, my pain level goes down.
And that's a really important point, I think, for all of us, whether we're on the treatment prescribing side or on the receiving side of pain management, to know that we need to be able to give adequate pieces of all of the options to pain management to increase function and quality of life. I think that the suffering that goes on is inexcusable, and the undertreatment of pain causes just as many adverse side effects as anything in pain management could, and more. We know that the undertreatment of pain can decrease the immune system and put us at risk, and the suffering that's involved is a horrendous thing. So I think that, you know, the relationship of having a team together, being the person in pain with the healthcare professional together as a team, coming together to do adequate pain management is so very important, and to look at that safety as well. So if you had 2 or 3 or 4 things that you really wanted to say about the safety from your perspective of your pain management regimen, what would you say they were?
First of all, keep track of your medications. When you get them, count them, just to make sure that there was no error on the part of a pharmacy. I mean, errors happen, you know, and the prescription companies are very, very serious about when you can get your prescriptions refilled. Second would be to keep them in a safe place, and not keep them in your medicine cabinet, not keep them on the kitchen windowsill, that kind of thing. Third would be to realize that you'll need, at times, you will need access to some pain medication, whether it's opioids or not, when you're out of the house, and to make sure that you do have that access should you need it.